This is Moment Tonight. Welcome. Many thanks for joining us. We bring you the real stories.
Abdallah, have you put pepper in the tea?
My environment alone will tell you that I'm rich.
I've chosen to be in one of the very shallow pits. They also do have miscreants, but it doesn't mean that all of them are criminals.
We do not have a good geo database of our mineral resources.
This is a time for us to share the oil money.
So terrorism is not going to be accepted on this continent.
If they see them coming here and going back there, they'll be killed.
But God willing, I'll be back alive.
We are just about leaving on the night patrol with the AU forces here in Somalia.
The real issues, the real talk.
We are working together for the development of Ghana.
It means that we have separation of powers.
Already we're talking about moving from what? A deficit of some 9% to 6.5%.
The critical challenge that faces every leader in the world today is the issue of creating jobs.
We will put at least 1 million people to work.
Ghana, after 60 years, has a public structure that is not responsive.
Mr. President, I know this is your main issue why you came here.
Join me, AfIHQSA Team. Moment Tonight. This is GBC News. This is Moment Tonight. My name is Mumin. I'm exceedingly excited to welcome you to the show tonight as we focus our attention on health. We're talking about healthcare delivery, and of course, we're looking at the quality and safety, if you like. Not a week passes by without our health desks coming out with stories about people complaining of the state of either the health facilities themselves or the attention that is given to them at these health facilities. Sometimes the attention is so deplorable to the extent that people leave hospitals, clinics, and other health centers with illnesses that they didn't have prior to attending those facilities for healthcare. There have also been complaints about the attitude of healthcare delivery workers, including doctors and nurses, as well as other paramedics and so on and so forth. And we will also spend some time looking at safety, not just safety for the patients, but safety also for the healthcare delivery workers as well. We know that when there was an outbreak of Ebola in 2014, 2015, many doctors did die in the process. Doctors are exposed to all sort of infections and so on. And so tonight we'll spend some time looking at the quality of healthcare delivery in the country, but also at the safety issues, as especially the Africa Institute of Healthcare Quality, Safety and Accreditation, and the International Society for Quality in Healthcare met in Accra today to discuss issues of quality and safety. We will be looking at what they came up with at that summit tonight on our show. I'll introduce my guests to you right now. At the far left is Dr. Gilbert Bakel. Dr. Bakel is the public health physician and consultant. Doc, thank you very much. We are grateful that you made time to join us here this evening.
Thank you.
Seated next to me is Elom Hilary Ochi. Elom Hilary Ochi is the healthcare quality and health safety consultant. Thank you very much, Ochi, for also joining us here on GBC News tonight. I did tell you that there was a summit that was organized by the Africa Institute of Healthcare Quality, Safety and Accreditation, as well as the International Society for Quality Healthcare in Accra today. Our news team was there, and they came through with this report. We'll listen to that report, and then when we come back to the studio, we'll proceed with the discussion.
The two-day summit will also enable stakeholders from both private and public sectors to share experiences. The program is aimed at improving personnel performance and the handling of healthcare equipment. The head of quality management at the Ministry of Health, Dr. Ernest Asiedu, said health workers need to be motivated to improve on quality.
Sending people to remote areas that people are uncomfortable. If you put some small attractants there and people have the opportunity to do something, maybe for 3 years, you sacrifice and serve the people, then there's opportunity for you to also develop yourself.
A Deputy Minister for Health, Mr. Alexander Aben, said health workers should make a formal commitment to deliver quality healthcare.
Quality is not static, and healthcare systems should have intrinsic mechanisms for continual quality improvement. Sustainable quality improvement does not happen by chance. It's a product of concerted efforts, including monitoring and measurement.
A technical officer within the service delivery and safety at the World Health Organization, Nana Mensah Abrampa, said primary healthcare systems should be strengthened to deliver quality at the district level.
Within the WHO, World Bank, OECD report, one of the key recommendations that it puts forth is that government should have a national quality policy or strategy. It's important that these services are timely, that they are equitable, they're integrated, and they're efficient.
Feedback from the summit will be used to guide and assess local, state, and national efforts to improve healthcare. It will also improve the overall quality by making healthcare more patient-centered, reliable, accessible, and safe.
Right, welcome back. I'm having a conversation with two consultants, one Dr. Gilbert Backel, public health physician and consultant, as well as Elom Hilary Ochi, healthcare quality and health safety consultant. We are looking at healthcare and safety. Doc, let me start the discussion with you. When you talk about quality, the word quality itself is a very subjective word. What might be quality to me might not be quality to you, and so on and so forth. And so let's put the conversation within its proper perspective.
I agree.
When we talk about quality in terms of healthcare delivery, exactly what does the quality qualify?
Okay, so thank you very much, and thank you to, again, your viewers. Healthcare quality has actually two perspectives. There's a subjective perspective and there's an objective perspective. So there's a non-debatable aspect to quality. And then there is the debatable aspect to quality. So the subjective perspective is more of the wants and the likes of the patient. So a patient may come and say that, you didn't smile at me. And I may say that, but I am smiling. Maybe my face doesn't look like it is smiling, but I am. So that is a debate. So that is the subjective aspect. A patient may come and say, the nurse or the doctor didn't speak respectfully to me. And I may say, oh, but all I said was, please sit down. And the patient may say, but you didn't say it politely. So those are the subjective aspects of quality. The objective aspect of quality are standard professional practices. So what it means is that if you have malaria, the evidence-based scientific treatment protocol is to give you artesunate. If I give you any other thing but artesunate, for instance, then I am not achieving the objective quality standard of treating you with the right medicine for the right disease. So when we talk about quality in healthcare, it's about healthcare providers, one, doing what it is they are trained to do in the proper way and manner in which they are trained to do it, using the proper medicines, the proper equipment, the proper technology to provide you care in a way and manner in which science and technology has defined. So that is very subjective. That has nothing to do with what you like and your preferences. Then the subjective one is what a lot of public hue and cry comes about. They weren't polite. They shouted at me. You were not respectful. They didn't even look at me. But the interesting thing is that healthcare services, and I think the focus is on service. It is a service. And the objective aspects of quality notwithstanding, the palpable part of it is the perspectives and the reality of the patient. So if the patient comes and tells me that, Doc, you were rude to me, unfortunately for us healthcare providers, it is that perspective that will rule the relationship and the dialogue. So there are two dimensions: the subjective perspective, what we wish, what we want, and the objective perspective, which is the professional standards of care that we're expected to met out.
Okay, so let me talk to Elom now. Elom, so you've heard Doc's definition of quality within the context that we're having this conversation. And so if his definition is anything to go by, let's take the objective definition that he gave. Do we have quality healthcare in Ghana, for instance?
Okay, so let me continue briefly from where he left, and then I will answer your question. So again, we have perspectives of quality. So it depends on who you are speaking with as to what is quality. If you speak to, say, NHI, what is quality to NHI? They are interested in the claims and the payments they are making as far as financing of healthcare is concerned. If you speak to a clinician or a clinical person as to their perspective of quality, they are interested in, hey, I need staffs to work with, and then patients have come. I have been able to sort the patient out as far as his or her disease condition is concerned. If you speak with the patient or the client or the consumer, then their perspective of quality will be what Doc talks about.
But shouldn't we have a unified, if you like, definition? Because healthcare is a broad umbrella under which you have the NHIS, under which you have the clinicians, under which you have even the patients and so on.
So I am building a point. So I will come to...
Great.
Yes.
Okay.
So when you speak with the consumers or the patients, their perspective and understanding of quality is also different. And that is what Doc alludes to, which is, did you smile at me? Did you welcome me? Did you treat me with dignity and respect? Did you have compassion over me as far as my care is concerned? Were you emotionally connected? Were you empathetic in the service you provided, etc.? So yes, there is a global definition for what quality is, but I wouldn't bore our viewers with what a global definition is. But there are some markers of what quality is in the global definition. So one of the markers we say is safety, that you have gone to the hospital, like in your introduction, you have malaria. You expect that when we have given you the medication, you walk home well. But when you have malaria, you go to the hospital, and when you are coming back home, we give you an injection and your back swells. That we have compromised on safety, because we expect that when we give you an injection, we should properly clean the place so that the medicine will go and work and there will not be any swelling at your back. Another has to do, we call the patient-centered care, where we expect that when you have come to the hospital, let us meet the consumer and meet the consumer's aspect of quality. So let us smile at the consumer. Let us be friendly with the consumer. Let us connect emotionally with the consumer. Let us relate well with the consumer. Those subjective aspects of quality that Doc talks with. That is what the patient-centered care or the person-centered care is more looking at. So that is a second marker of quality. So if you go to the hospital, you are able to tell that the way the doctor looked at me, maybe he or she did not smile, or that is your understanding. So that is what you walk away with. That is a definition and a marker of quality. Or you go to the lab, the way the lab person, he didn't explain the procedure to you. He just say, hey, mommy, bring your hand, let me take your blood, etc. That is what you will be carrying away as a marker of quality. There are 4 or 5 other markers of quality. I see, I don't know whether I can continue.
Please continue.
Okay, so the other marker of quality we also say is efficiency, which means that when we are providing care, we should provide the care judiciously, we should ensure that there is very little wastage in the service that we are providing. So health workers, government stocks hospitals with hospital beds, and then patient arrives and we say there is no bed. Meanwhile, the no bed is only in the emergency room. When you go to the other places in the hospital, there are vacant beds. Are we together? So it means that on those other vacant beds, nobody is lying on it. In the hospital, it is money. The hospital bed is money. When you put somebody on the hospital bed, you are charging for it, depending on the condition and depending on how long the patient stays on the hospital bed. It is money. When you speak to private healthcare with those in private practice, they will tell you. So if you have a hospital bed and nobody is lying on it, you are losing money. You are losing revenue. So you wish that somebody will be lying on the hospital bed so that you can recoup whatever cost and investment you have made. So once nobody is lying on it, we are wasting, and the hospital bed is a resource, and we are wasting it because we are not using it. Another example is we have to take you to theater, and we say that there is no space in the theater, or our light is off. We don't have things to work with. So the theater space, we cannot use it for that period that it has to be used. That is money, revenue, and it is just going down the drain. Another one, government will buy us gloves to work with, and then if you have 50 pairs of gloves, one box of gloves, which is the disposable gloves, and you have to do a procedure which requires that you can use one pair for every patient, and you use 10 pairs of gloves. How many pairs are left? 40. And you have attended to 10 patients, and we come and ask you, where is the extra 40 pairs of gloves? You say you don't know. You have been wasteful as far as the use of the... So these are some markers that we can use, and it makes us able to measure quality objectively all over the world and then all over. So we can tell that when it comes to efficiency, if we take Ghana, how is the efficiency of our health system compared to Sierra Leone, Liberia, the US, the UK? If we take patient-centered care, how are we faring compared to other countries? Because the markers are universal and they are assessed universally.
Great. Doc, let me return to you, but before I do so, halfway through the show, we shall put up a number that will allow some of our viewers, and I do encourage even health care service providers to call in and share their views with us regarding the issues that the problems people have with healthcare delivery. And I'm sure that when the phone lines are open, Doc, you will hear some of the concerns, because you talked about subjective definitions for healthcare. But I can tell you, Doc, that if I know, or for that matter, many Ghanaians know of a private healthcare, maybe a clinic or hospital, and then there's a public one. If people can afford, they would go to the private one and not the public one, because at the private hospitals and clinics, the delivery of healthcare is, whether you talk about it in subjective or objective terms, it's quality as compared to that of public healthcare system. Why is that the case?
So let me just give a little clarity on the subjective and objective definitions. For instance, I'm smiling. As I sit here now, I believe strongly that I'm smiling at you. Whether you think I'm smiling or not is another question.
But that smile is likely to be broader if I come to your private clinic.
No, so
it will be broader.
Broader is subjective. So the standard appreciation of even the subjective issues is the same. I need to show respect. I need to be polite. It's only subjective because the extent of it and the showing it can be debatable. That's the only reason why we call it subjective. But it is real. The objective issue becomes, I should have given you paracetamol for the headache, not Brufen. not codeine. So in that, it is much easier to see that the quality of my treatment I gave you was poor because I didn't use the right medicine. It is very easy to do that. That is why we call those ones objective measures of quality. So it's not saying that what the patient expects is not right. It's a valid issue. So having said that, public sector, private sector, the issues are more about accountability, issues about being service-oriented. So for instance, in the private sector, if I don't get any patients and clients coming to the facility, I will not eat, putting it simply. In the public sector, I'm on a fixed salary. Whether you come, whether you don't come, whether I smile at you, whether you like my face, whether you don't like my face, at the end of the month, I will be given a salary. And that becomes the fundamental difference between private sector motivation to address the desire of the client. And as those in business, and they will tell you, the customer is always right. And that is the fundamental difference between the public sector and the private sector. Or where you have the public sector, you've got a guaranteed income. Your boss is so far away from you. So if truly the patient complains or does not complain, it doesn't affect me in any way. But in the private sector, if a patient complains and comes to me and I say, look, you are damaging my reputation, you are damaging the integrity of the institution, and that patient tells other people, and I'm losing clients, that is a big issue. And that is why in the private sector, they are much more able and focused and motivated to ensure that quality, subjective and objective, is at the highest level of service delivery.
Doc, you are a physician, and we are told that recovery from any illness begins with the psyche of the patient.
Great.
And so I come to your hospital and I find you, whether subjective or objectively, as a very unwelcoming doctor.
Yes.
I mean, from the onset, it will take some time for me to be cured.
Good. What you are saying is what is motivating us to embark on these summits and these events. So the fundamental training of the average health worker is technical. The social dimension, the psychological dimensions, the human aspects are not played up in a big way. So yes, we are aware that the social environment, the emotional environment enables and supports healing, but for one reason or the other, we focus a lot on the technical aspects of the work we do. So having a quality summit like we're doing is raising and bringing back into awareness and into focus to health workers especially, that you know what, the concerns and the desires and the mindset of the patient is also part of the healing. So let us be aware that smiling is not a favor, it is part of treatment. Being polite is not a favor, it is part of care. Being respectful is not a favor, it is intrinsic and relevant and critically important to making sure that the patients we see get better when they encounter us. And leaving them with a good impression and a good memory and a very nice experience of being in our presence in itself is healing. So the purpose of us engaging in the quality discussions and promoting it and bringing back into perspective is because of exactly what you're saying. It is not just about giving somebody paracetamol. It's about how you give it. And that is what is important. It's not just about putting somebody on a table and doing surgery. It's about how you prepare the person, how you manage their anxiety. It's about post-surgery, how you let them understand what is happening to them. All that facilitates and supports healing. And at the end of the day, it's a win-win situation. I, as a practitioner, am happy that when you came to me, I was able to make you well. And you are happy that when you came to me, I didn't disrespect you and treat you as an object.
Look, I'll return to you, but Elom, are you aware of, because we are aware of those stories, yes, where people go to health facilities, sometimes in ambulances, in hired taxis, in a rush because they feel their loved ones are dying, and as soon as they arrive at the health facility, there's a lackadaisical approach from nurses, even from doctors, from other health workers. Are you aware of these stories?
Yes, I mean, yes.
That's a big compromise on healthcare delivery.
You see, what I often say in some of these, so let me start with this. I sit in a mortality meeting, and then
what's that? What's mortality?
to your audience. So I go to a department, and then mortality meetings is that when somebody dies in the care of the practitioner, they meet. It can be in the morning, whichever time in the day, and then they review what killed the person, so that they can put measures in place to ensure that the next person does not die of what killed the previous person. So I sit in this meeting, and one morning I was there, and then they were discussing what had killed a pregnant woman who had come. So in the discussion, they had finished and there were discussions. So I raised up my hand and I expressed shock and disgust, just like you are expressing now in the question you ask. And then the head of department at the time looks at my face and says, "Young man, no doctor moves from his or her house to the hospital with the intention to kill his or her patient." That was very deep and very insightful. I mean, in the world, there have been instances of healthcare practitioners who have deliberately done harm to their patients. But I mean, if you take the numbers, it is not as much as the good ones. So that was very impactful, and that was a very powerful statement that was made by that head of department. So I started reflecting. There are so many things that constrains the practitioner to do good. It is not an excuse for any practitioner to do bad. I am saying that in the limitations of practice, there is no excuse to do bad. The system continues to struggle to do good. There are lots of good people in the system that we should also deliberately praise and protect. So I think that it is a matter of continuously creating the awareness that the emotive part of healing is as equally important as the technical aspects of the healing process. And that will take a very long time. And that is where I don't think that as a country there is enough inertia and movement towards, because we have become fixated in the infrastructure, the hardware aspect of quality, and it looks like we are neglecting the soft side and the software aspect of quality. But there will have to be a deliberate balance and ensure that how are we able to effectively prepare our healthcare providers to be enormously aware that in providing healthcare, we have to be compassionate, we have to provide care with dignity and respect, and we have to see the patient as a human being, other than a malaria case, a TB case, a diarrhea case, or a cholera case, or whatever label that we place on the people. I think when we start doing that, our attitude towards whoever is sitting in front of us would change.
Okay.
And it becomes a movement, and then we proceed gradually as far as getting to where we want to get to is concerned.
Doc, you know, on this show we call it a talk show.
Yes.
Because we sit and talk around the table just like we are talking. You had a summit, you had several speeches, beautiful talk. But I always say I wish this show was more like a walk show where we take action instead of just talking. Now we are talking, you have also talked, and you are talking here. But when are you going to walk the walk? When are we going to begin to see the loopholes within the health sector that amount or account for some of the stuff that lead to the quality really not being there, that these factors are addressed? When are we going to see the walk instead of just the talk?
Okay, the work has started. The work has started. The work started in Ghana in a very structured way in 2017, when the Ministry of Health came out with a national quality policy and strategy, which sets the entire health system to focus on the quality issues of care. Now, So that has started. So crawling, standing. The purpose of the summit was to hold that baby and say, you know what, you can start walking, I will support you in the process. So the walking has started. In the process, we also then realized that dissemination has been done, but they need to do more. And we're happy to know that the ministry is committed, the Ghana Health Service is committed, and we as AfIHQSA are also committed to support, to continue to create the awareness. I think our presence on this talk show for us is part of the work. Coming out boldly to speak about the issue, coming out boldly to create awareness is part of the work for us.
But if you if you just create awareness and even people get to know that
we spent the whole of last year doing trainings, professional development, skills development training on what to do, how to plan, how to actually do quality. As part of the summit, the 2 days, yesterday and today, we had 2 master classes teaching people competencies on how to lead in your institutions and harness people, and how to actually intervene on issues of quality you want to do. We also intend to prepare a white paper out of this summit, clearly articulating recommendations and interventions that must be done. We are committing to follow up on those recommendations for 1 year till we have the next summit, to continue pushing government, public sector, private sector to do what? To walk and do what has to be done. We are positioning and continue to partner with ISQA, the international groups, to bring in resources in terms of how to develop people, how to train people, skill sets and tools and methodologies, so that the health worker has the ability to actually do the intervention. So the talk is what we have done. So for us, like I said, being here and talking to your viewers is working.
Okay, I understand that. But see, Elom, when I drive and I get to the zebra crossing, I always look out for other cars ahead of me to find out what they will do. And I know that the drivers, it's not a matter of fact that they are not aware that you have to stop for pedestrians to cross before you go. It's just because if you don't stop, there is no punitive action that will be taken against you. And so, yes, you may have drawn the attention of health workers to what they need to do, you know, to ensure that patients feel safe and all that. But if there are no measures to punish people who flout such regulations at health facilities, we'll come back to square one.
Yes, I mean, and that is excellent, and I agree with you. Accountability is very key when it comes to the provision of quality healthcare. So there are various measures of accountability. I think one of the measures of accountability has to do with the strength of regulation and the people who have to ensure that human beings are doing what they should be doing. I mean, because naturally we are bad. Naturally, if you leave me,
like we are bad.
Yeah, I mean, if you leave me, I will do what I want to do. Yes, I mean, I will not smile with you. I will do all the negative things that I feel I should do if nobody is watching me. So regulation is very important. Regulation of the practitioners is very key. So that is why in the healthcare space, and particularly in Ghana, we have the councils and the professional councils that should be ensuring that the practitioners are doing what is expected of them as far as improving the quality of care outcomes is concerned. So councils and institutions like the Nursing and Midwifery Council, which is responsible for ensuring that nurses and midwives in Ghana are doing what they should do as far as supporting and providing quality healthcare. The Medical and Dental Council, the Pharmacy Council, and the Allied Health Professions Council. So I'll come to HIFRA. All these guys are supposed to ensure that the practitioners are doing what they must do. If they have to smile at a patient, they are smiling at the patient. If they have to be courteous at the patient, if they have to ensure that care is provided, guided by the standards, they are following and doing so. I have a colleague in the US. He tells me that every week, at least a regulatory body will come to their lab. He is a biomedical scientist. at least every week there is somebody in their lab picking samples to go and check whether what you are doing is in conformity to the appropriate standard.
Right.
Maybe quickly, let me add, there is also the Health Facilities Regulatory Agency in Ghana, which is HIFRA, that should ensure that our infrastructure and so many other quality indices are up to scratch. So it is a charge and a task to the regulatory bodies that they will have to be more proactive as far as ensuring that we practitioners are doing the right things are concerned, and we are not cutting corners. And the health consumers also have a responsibility to demand quality and to demand that the providers are doing the right things. Elsewhere, when a provider wants to attend to you.
Yeah. All right. So I'm sorry to cut you. I'll bring you back on. You can call us right now on the number that has been provided on the screens for you right now, and we have callers standing by already. Hello. Good evening. Many thanks for calling. Tell us your name, where you're calling from, and proceed to tell us what you make of this discussion.
Good evening. My name is Fred. I'm calling from Tetegu. Yes, I'm calling in relation to what you are talking about. Just today, I went to a hospital that is Akaway at Makati Hill. I took my wife there, and that was our first time because of pregnancy issues. Now, what happened is that we were asked to wait for the scan.
Yes, please proceed quickly.
Okay, so before then, my wife was told to go and get water and drink. So we got the water, we came back, entered the room, then I asked him, okay, we've gotten the water, she's drank the water, so what's next? And we had to wait. After 15 minutes, I waited, I went back, I said, okay, we are still waiting. All the guy told me was I should go back and wait. I said, what am I waiting for? Great. What is the reason why you are asking me to wait?
Great.
Just give the reason. He said, just wait, and then when you finish, when we are ready, we will call you. And so we waited for 1 hour only for them to come back and tell us that, okay, so come in, they are telling to it, that is it. The issue is that even when you go to the hospital, you ask the doctor, these are the symptoms. What is wrong with you? The doctor says, okay, just take this medicine. Yeah. What is wrong with you? They don't even explain to you the sickness you have. They don't even tell you what are the causes.
Okay, so fortunately we have a doctor here. We'll find out why they do that, if indeed they do that. And thank you very much for calling in. You can also call. The number is on your screens right now. So you heard his complaint.
I mean, I hear what he's saying, and that is half the time or more than half the time the reality. If we were providing quality of care, one would have said, oh, hello, sir, your wife needs to drink so much water because we want XYZ to occur, and it will take us 20 minutes to come back to you. That already, he knows what is going to happen to him. If he came in after 20 minutes, ours would have to say, oh, yes, we said 20 minutes, we are sorry, but there's another patient, could you wait another 15 minutes? I want to believe that this already would assuage his anxiety and the sense of helplessness that he felt in that situation. Now, some of these things, some of us, we need to go back and teach it in school. The human factor issues.
Okay, so another caller is on the line right now. You also tell us your name, where you're calling us from, sir.
Hi, Moment. Good evening.
Good evening. Please go ahead. Your name, where you're calling from.
Yeah, my name is Evans. I'm calling from North Carnation.
All right.
I'm very happy you have come up with this topic about the quality and the safety. My issue here is that most of the time, who is monitoring all these professionals? You go there, there's nothing. We could fix CCTV cameras where the supervisors will be there monitoring to make sure that this implementation of whatever policies has been put in place are being made there to everybody to know. So that when there's anything, like you said, who punishes who, these things can be taken. We see this serious canker in the public sector, unlike the private sector. I have an uncle who is a doctor, and I remember very well when we were kids. You go to him, he'll be talking to you, smiling. Once he shakes your hand, he's checking on you. You may come afraid of being injected. You say, oh, I have headache. Perhaps it's not headache. But while shaking you, talking to you, looking under the lower part of your eyelid, and then at the end of it, the way you say, this is what is wrong with me, will tell you, okay, this and this is what I see. So you have to take this, do that, and come back 3 days or something, and then we'll see. And lo and behold, he stayed in Kintampo, if I should mention the area, for several years. He was not being moved because everybody wanted him.
All right, thank you very much. Yes, you've said enough. He is asking the question, so who is monitoring the professionals? But one important question also is that the professionals also suffer abuse from patients and relatives of patients. That's also a fact that needs to be addressed.
I think quickly on the last caller, on who is watching the professionals. That is where I was talking about, which is the regulation. So the various professional councils, it is one level of accountability.
Yes.
The institutions themselves will also have to design appropriate mechanisms to ensure that they are able to self-regulate as far as professional practice and what impacts their outcome is concerned.
Another caller is on the line. Tell us your name and where you're calling us from, and be straight to the point, please.
Okay, my name is Charles. I'm calling from Kokomlemle.
Right.
I was driving one time and I encountered an accident, so I decided to help out. I carried the patient to a hospital, and nobody seems to even care about what I brought to show. I went to about 3 different hospitals with the patient in my car, an accident victim, until I got rescued in one of the hospitals. I don't really know what is going on with our health delivery system. I nearly wept that night.
All right. Thank you very much. But I also love it if we can have a call from one practitioner who also has suffered some form of unprofessional behavior from patients and probably relatives of patients as well. We may want to have that perspective as well. So he's made a point that I've already made. He's driven a patient to the hospital, an accident victim, and they didn't get the attention that they required.
Yes, you know, like Elon rightly said, with all the limitations and constraints that the health service faces and the health professionals face, it is still no excuse. It is still no excuse for healthcare workers to met out services totally below quality. It's no excuse. You know, I mean, and that's just the fact of the matter.
We have another caller on the line. That'll be my penultimate caller. I will take the last caller and then we'll wrap up. Yes, what's your name and where are you calling from?
I'm Auntie. I'm calling from Richecam.
All right.
I am Auntie.
Auntie, please go ahead and tell us what you make of the discussion.
I want to know if you attend a hospital and there is a lab test done on you. If you have
There's a what?
Demand,
okay, right.
If you have the right to call for a copy of your lab test.
Interesting. Thank you very much. Yes, the professionals are here to answer your question. We'll take one more call and then we'll get all the answers. But quickly, very interesting question.
Yes, I mean, why not? The lab test, the result is yours. So you can request for it and you should be given. Fortunately, Ghana has passed the Right to Information Act. So, hey, what are you hiding somebody's lab result for? Probably in the lab, it may not be the responsibility of the lab personnel to explain the details of the results. Absolutely. So get the results sent to the person who requested for the test. And it is that person's responsibility to ensure that the patient understands the content of the results and then what next steps will follow. Period. And you are done. Why are you keeping somebody's lab result? What are you going to use it for?
I mean, we'll take the final. Yes, we'll take the final call and then we'll wrap up with all the answers. Hello, thanks for calling us. What's your name?
Okay, this is Morgan calling from Boche.
From Bupe?
Boche.
Boche. Yes, okay, exciting.
Yes,
Okay. So I might say that I'm very happy concerning this topic that is being discussed here. But all I want to say is we are talking about quality and safety of the healthcare delivery in this country. Yeah. And one thing I always talk about is that we are talking about healthcare quality and safety. But when you look at some of us happen to be in the health sector, and to be realistic with you, sometimes when patients or patient relatives comes to the hospital, they need to consider the situation under which the health workers are. Sometimes they come, you can't be attending to a patient, and somebody also comes in, and you leave that very person to go and attend to that the next person, and that is where we zero down to the labor force in this country. We don't have the workforce. So you go to the ward and you have about over 60-something patients in the ward, but the staffs are few. How are they going to do all this? And looking at those things, the stress levels and all those things, the worker is so tired, but there are two patients that are being moved in emergency cases and all those things. How are you going to continue to implement quality and safety even when you yourself, your quality and safety is not that secured? Because the more stress that you are exposed to, that's why sometimes based on the frustrations from patients and their relatives, they speak harsh to people, especially the health workers, and we are able to condone all those kind of stuff. But the point is that sometimes they keep talking to the point that you yourself, because you also lose that kind of temper and all those things, so you end up saying certain things, and they feel that. But one of the things I have to say is that if we want to talk about quality and safety in this country, we have to look at the labor that is needed in the health sector before we can be talking about all
interesting. Thank you very much for calling. We are grateful for your time. He's made some very important points there. The stress level on the part of the health workers, also the workforce, and the pressure on some of these health workers and so on may contribute sometimes to the frustrations that may lead to reactions that we may then interpret as unprofessional.
Yes. I mean, I want to congratulate the last speaker, because these are the realities we were talking about. There are real constraints in the sector. Having said that, as a health professional myself, I ask myself, would I want to come into this health facility if I were in a situation where I needed healthcare? There's a lot of, we don't want to be pointing fingers and apportioning blame. AfIHQSA has taken the position that what we can do in our purview, we should. What does it cost to smile? Yes, we are under stress, the pay is the pits, the patient, the average patient is not in the right state of mind. You are afraid when you enter the health facility. You don't know what is wrong with you. You don't know whether you are going to come out alive or dead. And we know that as health professionals. So we are saying we need to prepare ourselves to learn how to accommodate some of these utterances and behaviors of the patient. Because we would have done the same if we were in their situation. Having said that, the other resource requirements we know are relevant. But can we continue sitting down and waiting for the resources? I had a situation when I was doing my housemanship, and my consultant said, Gilbert, I'm going to teach you everything I know, because I may be wheeled in here one day, totally comatose, and I don't want to get up and say, I didn't teach him and show him what to do in this limited, in this situation. So if we have anything, the health worker must be looked after. That is not a debate. But there's so much we can do ourselves. Some of us have experienced the failure in the quality of the system on our own relatives, very close friends. And we were so embarrassed as health professionals when they came and said, this is what happened when I got there. Everybody in Ghana now needs to know somebody in a health facility. You dare not go there not knowing anybody. And for those who don't know anybody, it is the most frightening experience you can go through.
Yes, but to the extent that health workers are also human beings who are subject to the kind of reactions that we all go through, what is the responsibility of the patient or the patient's relatives towards the health worker as well? That's the relationship must be symbiotic.
I mean, fortunately, the Ghana Health Service has developed the patient charter and the patient rights. I mean, there was one meeting I saw Kofi Kapito, the consumer activity, making a lot of, making it public, etc. I think that as much as possible, that document will have to be widely disseminated, both for the clients or the patients and then for the health workers as well. As a sector, we should also look at empowering the patients that is empowering the demand side as far as quality is concerned. Let us cause them to appreciate the stress that the health worker goes through. I mean, if you come and we explain to you that, hey, guy, look, you are 60 people at the OPD. I am the only doctor in the consulting room. I have only one nurse in the consulting room. I came to this hospital at 4 a.m. because of an emergency. Yeah. But it is 8 a.m. I have not gone home. Because of the crowd at the OPD, I have to make sure you are all sorted out. So guys, relax. I will make sure that you have all been attended to once we all comport ourselves, because that is why I am here. So please, be patient in the queue and be orderly, and then we will attend to you. Which rational person in the queue will behave otherwise? Are we to, so that is, there will have to be that relationship. I mean, you go to the airport, if your flight delays, every minute they are telling you why there is a delay in your flight. Relax, be patient. We are
in some airports.
Okay, some I mean, even the I mean, for the airports I have traveled, I mean, this happens. So I think it is about constantly engaging one another, constantly empowering each side, the clients, the consumers, and then the providers as well. But I also think, again, more importantly, that we will have to, as a service and as leadership in the service, the healthcare providers will also have to be appropriately taken care of, because they are the engine. If you want quality of healthcare, I mean, it is disheartening that in most public facilities you will be working. If you fall down today and there is any emergency for you, you will have to buy your medication. You will have to pay for your admission. If you go to the lab, you will have to pay your own lab test.
Health workers.
I am telling you, yes.
The only benefit is free mortuary services.
Free mortuary. These are,
you don't really need it.
I mean, so these are very stark and painful realities in the service for public service. Hey, so what is the motivation to deliver quality? I should smile at you when I haven't eaten. Hey, like seriously, I should smile at you when I have walked like 20 miles to the hospital. I am drenching of sweat. I mean, but
I do understand those frustrations.
Let me quickly add, and before somebody calls that, it is no excuse to slap a patient. It is no excuse to insult a patient. It is no excuse not to do what is expected of us. But our paymasters should help us also to do the right thing.
You see, I've been telling young journalists who come here, say, and want to complain that there are fellows who are into banking are making more money. So, well, you made a choice. Journalism doesn't pay, but you chose journalism over banking or over any other profession. And so those are the repercussions, and you must learn to deal with the repercussions. You chose to become a health worker. You knew about the repercussions and all the other circumstances you'll be working under, yet you chose to do that profession. So you must do it and do it well.
Yes. I mean, you know, things have changed. Things have changed. I'm not that old, but those who go into health really have a compassion and the empathy to help people. People now come into health thinking that it's a money-making space. And the focus the whole living condition issue is impacting on the health sector in a very negative way. And I think one speaker said the whole system is being poisoned by this mindset. But you cannot work in the health sector without some empathy, without compassion, without a sense of giving of yourself. That is what makes you a health worker. You cannot come into the health sector and think it's all about money. It's all about money. It's just not a tenable position. It's just not a tenable position. But that, like Elon is saying, and I'm sure it affects many other professional groupings who then enter it and say that, look, you are not paying me enough. I'm going to find my own way out. We've said it between the two of us consistently. It is no excuse, and we should still be able to provide better quality care than we are providing now without even an additional penny, in resource or in anything.
So you have ended the summit on quality healthcare and safety.
Yes.
What was the feedback like?
I think it was very impressive and exciting. You see that there is a lot of will on the part of healthcare workers to do right, but how to do it is a challenge. There are not enough resource persons in country and even continentally. So, I mean, it is a call for synergy. It is a call for partnership and collaboration because it is a lot of work in the health sector. I mean, there was the NHIA Deputy CEO mentioned there are about 14,000 healthcare facilities in country. One of our colleagues was saying, hey, the figures might even be more because if you see how the rate at which we are opening CHIPS compounds and other primary, secondary level facilities, you would realize that the rates will be more. So, I mean, the feedback was impressive. It calls again also that there is also another level of work which has to do with empowering our patients and our consumers, encouraging them to know and to bear and to share the pains and the frustrations of the healthcare worker, and even see how they are able to support in alleviating and then playing a critical role in ensuring that the patients, are receiving the quality of care that they are expected to be receiving.
We've actually run out of time, but very quickly, Doc, let's touch a little bit on the safety, maybe in a minute or two. You are a practitioner. Do you feel safe when you're attending to patients, considering the fact that you could yourself be infected if the proper, gear, protective gear and so on is given to you to do your work?
No, I mean, safety is an emergency for service providers. Barrier methods, infection control, gowns, gloves, face masks, and especially for the nursing staff. Safety is a big issue. You're having to lift patients, move them, and you are doing this physically. There's no equipment to help you lift heavy patients, to move patients across. So this health worker is getting pains in the waist and sprains on and on. Infection, needle pricks are just there, getting exposed to many other contaminated products. Disinfectant, and having the basics, disinfectants to make sure I can clean the place and make sure it's sterile. Having enough barrier clothing to protect me from coughs and other ways of catching infection. So we are very mindful that it's only by grace at times that you survive the year, because some of the conditions you face are so infectious. You ask yourself, why didn't I get infected?
Wow. This summit, is it one-off? Is it an annual event?
Yes, so we are looking at annually. It's going to be an annual event where we bring thinkers who can support how we shape healthcare delivery on the continent. So it's not going to be a one-off. It's going to be something we do annually, because, I mean, our consumers and our patients are not waiting for us. No.
All right.
And day in, day out, the demands continue to increase and the demands continue to be complex day in, day out. So we will have to position ourselves as providers and as a health sector to meet and exceed the expectations of our clients.
And if you still have any concerns, we have a WhatsApp number that's on your screens right now. You send us, even after the show, you can continue to send your messages. We'll make sure that the team here will get hold of those messages, and if there's any action they can take, they will take that action. It's 020-542-5070 on your screens right now. You can continue to send us the WhatsApp messages. We'll forward all of them to the appropriate people to address your problems for you. Thank you very much, gentlemen. I'm hoping that next year, God willing, we'll be back here to have a discussion, and then we can then talk about the progress that has been made. Many messages have come in. We won't have time to read them, but one of them that I cited whilst you were talking was the fact that somebody was saying he hopes that doctors, next time you go on strike, will not be about salary, but will be about the conditions.
That would be phenomenal.
Yes. So we hope you don't go on strike. We hope you are able to call for the improvement of the working conditions, but without having to go on strike. Thank you very much for being a part of the show. We'll see you again tomorrow. We'll bring you another edition of Moment Tonight. Have a very good night. Bye-bye. This is Moment Tonight. Welcome. Many thanks for joining us. We bring you the real stories.
Abdallah, have you put pepper in the tea? My environment alone will tell you that I'm rich.
I've chosen to be in one of the very shallow pits. They also do have miscreants, but it doesn't mean that all of them are criminals.
We do not have a good geodatabase of our mineral resources.
This is a time for us to share the oil money.
So terrorism is not going to be accepted on this continent.
If they see them coming here and going back there, they'll be killed.
But God willing, I'll be back alive.
We are just about leaving on the night patrol with the AU forces here in Somalia.
The real issues, the real talk.
We are working together for the development of Ghana.
It means that we have separation of powers.
Already we're talking about moving from what? A deficit of some 9% to 6.5%.
The critical challenge that faces every leader in the world today is the issue of creating jobs.
We will put at least 1 million people to work.
Ghana, after 60 years, has a public structure that is not responsive.
Mr. President, I know this is your main issue why you came here.
Join me, AfIHQSA Moment Tonight.